Hello and welcome to Pace Hospital's podcast. Today, we are focusing on an essential topic for overall health, that is kidney function tests, which play a crucial role in detecting kidney problems early and monitoring kidney health. Joining us today is Dr. Abhik Debnath, consultant laparoscopic urologist, endourologist, andrologist, and kidney transplant surgeon, with extensive expertise in diagnosing and managing kidney-related conditions. In today's episode, Dr. Abhik Debnath will help us to understand what kidney function tests are, why they are important, when you should get tested, and how this test helps in early detection and effective treatment. Dr. Abhik Debnath, thank you for joining us at Pace Hospital's Hitech City.
Welcome. I am Dr. Abhik Debnath, consultant urologist, andrologist, endourologist, laparoscopic surgeon and renal transplant surgeon at Pace Hospitals, Hyderabad. Today we will be discussing about a very common topic, which is kidney function tests.
Let's start by understanding what is kidney function test.
So basically the function of the kidney is multifold. The kidneys not only excrete the nitrogenous wastes from our body, but it also helps to regulate the water and electrolyte balance, calcium balance, and formation of blood products. In simple terms, kidney function tests include a set of blood tests which helps us to estimate the function of the kidney. Usually, the tests include urea or blood urea nitrogen, creatinine, and serum electrolytes. Some laboratories also include calcium, phosphorus, and uric acid in the panel of kidney function tests. But it's important to remember that these tests alone do not indicate the function of the kidney. There are many other tests, simpler tests as well, like urine routine and microscopy and urine spot microalbumin, which helps to estimate the functional status of the kidneys. But usually in common parlance, the kidney function test includes a small set of blood tests, as mentioned above.
So doctor, what are the types of kidney function tests?
So KFT includes urea or blood urea nitrogen, creatinine, and electrolyte levels, which includes sodium, potassium, and chloride levels. Some laboratories also include acid-base. That means it includes the bicarbonate levels, the calcium, phosphorus, and uric acid levels.
Dr. Abhik, how is a kidney function test done?
The routine or simple KFT or the kidney function test, or some call it as a RFT, is a simple blood test. It is a single sample test which is done by a small puncture in the vein and withdrawal of about 3 ml of blood. The test reports come within 3 to 4 hours of sampling of the blood and processing in a laboratory.
Can you explain what are the results of kidney function test?
The kidney functions like a filter, so it filters our blood. So there are two main components or parameters of kidney function. So one is the glomerular filtration, that is the filter which is present in the kidney, and the other one is the tubular function of the kidney. So the levels of urea and creatinine are usually they denote the filtration function of the kidney, and the tubular function is mainly denoted by the water and electrolyte levels and the acid-base levels.
So doctor, what are the interpretation of kidney function test?
So basically kidney function tests, when they are abnormal in the sense when they are abnormally high, that indicates that the overall global functional status of the kidney is impaired. So it can be either due to acute injury, that is a sudden injury to the kidneys, or it can be due to chronic diseases of the kidney involving the kidneys like medical diseases, or it can be because of other pathologies which includes stone disease, infection, inflammation, or other medical disorders like diabetes and hypertension.
Could you explain what are the normal range values of kidney function test?
So the most important component of a kidney function test or renal function test is the serum creatinine level. So the serum creatinine level depends on the patient's gender as well as the patient's muscle mass or body weight. So for normal adult male, the usual normal creatinine levels range from 0.7 to 1.4 milligram per deciliter. And for adult women, it ranges between 0.5 to 1.1 milligram per deciliter. Obviously, the creatinine is a end product of muscle catabolism. So if the muscle mass is more, then the creatinine normally is expected to be on the higher side. And on the vice versa, when muscle mass is less, that is in a lean and thin person, the creatinine is expected to be normally low.
Dr. Abhik, what are the importance of kidney function test?
Kidney function tests are important to know the function, the overall or the global function of the kidney. So if kidney function tests are deranged, that means the kidneys have been either acutely or chronically damaged by illness or disease involving the kidney.
So doctor, what causes abnormal kidney function test?
Abnormally high kidney function test can be in two situations. One is if it is truly false or truly abnormal. So a truly abnormal kidney test indicates that the kidneys have been damaged by disease and therefore the kidney tests are elevated. On the other hand, there can be a situation where kidney tests are abnormally high but the kidneys are functioning well. This situation is called falsely abnormal values, which can happen in a state of dehydration. Dehydration can be either due to inadequate water intake or increased water loss in the form of either diarrhea, vomiting, burns, or increased insensitive water loss in case of exposure to warm weather. So in such cases, renal function tests can be abnormally high.
Is fasting required for the kidney function test?
No, fasting is not required for kidney function test, but it is important to be adequately hydrated at the time of testing.
Dr. Abhik, can dehydration affect kidney function test?
Dehydration can affect kidney function test. There will be decreased perfusion or decreased blood flow to the kidneys, which lead to abnormally high kidney function test parameters.
So doctor, can kidney function test detect cancer?
Usually no. Kidney function tests are simple blood tests. They mainly indicate the functional status of the kidney and they are not meant for detection of cancer in the kidney. For that, we need to image the kidney with the help of scan, either ultrasound, CT or MRI scan.
Could you explain what does high sodium chloride in the kidney function test indicate?
Sodium and chloride are important electrolytes in our body. Sodium is an important cation or positively charged molecule and chloride is an important anion or a negatively charged atom in our body. Balance is regulated by the functioning of the kidneys. Usually the levels of sodium and chloride go hand in hand. Sodium or chloride level can be because of either loss of sodium and chlorine or it can be because of increased amount of solvent or which is called due to increased consumption of water or because of inadequate filtration or excretion of water. Similarly, so high levels of sodium and chloride is usually, it can be due to proportionately higher amount of loss of water or because of solute excess.
What is creatinine level in kidney function tests and its effects on kidney function?
Creatinine is a product of muscle catabolism or protein catabolism and it is excreted through the kidneys by the filtration apparatus of the kidney, that is the glomerulus. So if there is abnormally high creatinine, that means the filtration function of the kidney has been affected.
Dr. Abhik, one final question. What is gamma glutamyl transferase in kidney function test?
GGT is an enzyme. It stands for gamma glutamyl transpeptidase. It is not a part of kidney function test. It is a part of liver function test.
Thank you, Dr. Abhik, for sharing crucial information regarding the kidney cancer to our listeners. We hope this information helps our listeners. Gaining a better understanding of kidney function tests and knowing when and why they are important can play a key role in the early detection of kidney-related issues and maintaining long-term kidney health. If any of you have further questions regarding kidney function tests or concerns about your kidney health, Please don't hesitate to consult a urologist. Remember, healthy kidneys are essential for your overall health and well-being. We'll see you soon with another informative episode on Pace Hospital's podcast. Until next time, stay informed, stay proactive, and take good care of your health. Thank you.